What's up, guys? Welcome back to another Clinical Conversations video. If you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. And in this video, we are discussing the foot, and specifically an analogy that I like to use with patients, especially the ones that are super stiff. So the foot is really the key component that we have and humans have to understand what we need to do. Do we need to change things up the chain? Do we need to bring our center of mass forwards, backwards? There's so many things that the foot tells the rest of the body to do. And I recently heard a really good analogy, and I thought it would be valuable to share it with you. And that is, if you can think of the foot as a tripod, if you had one part of the tripod on the ground and the other two legs off the ground, how do you think that tripod would stay up? Now, obviously in this example, it wouldn't, but think about the human body in the same way. If we have a tripod here and there's only one point on the ground, can you just visualize how much the body is going to need to tense up to not fall over, to breathe, to perform exercise, to do whatever the task is, because we don't have the points of contact that we need to relax. So if you're dealing with someone that is just super rigid and stiff, ask yourself, check what's going on from a foot perspective. Where do we have points of contact? If you stand behind someone and watch them as they just stand normally, you'll start to see things, but then ask them what they feel. And when you ask them, it's not, what do you feel? It's, hey, Mr. Jones, on your left foot, do you feel like the weight you feel or the pressure you feel is more so in the heel, the midfoot, or the toes? And then they'll tell you, and then go medial to lateral. Okay, so Mr. Jones, you said it was the toes. Do you feel more the inside component or the outside? And then we compare it to the other. And what you want to look for is, does what they're saying match what you're seeing? Meaning, if there is a pronated foot on the right side, do they feel that medial contact, or do they feel that outside border? And so you start to learn what they feel and sense, because just like the tripod analogy, if they don't have their full points of contact, it's going to be really hard to get this person to actually decrease motor output of the muscles, decrease how much those muscles are firing and tense, because they don't feel balanced. They don't feel like they actually can sense the ground. So it's a relatively simple concept. It's harder to execute and learn, for sure, but it's a simple concept that I think makes a ton of sense. So the key point of this video is I encourage you to start looking at the feet and asking patients what they feel and seeing if it matches with what you feel, and then we need to do something about it. Then we need to teach them how to get the right points of contact. For the body to really relax, we actually need 4 components. We have the first met head, the fifth, and then both sides of the calcaneus. So it is like a tripod. But if and when we can achieve that someone truly feels those points of contact, then we can start to get the body to relax, and then we can start to get the hips moving, right? All the things that we're trying to do. So the foot, although it's a very key component, so the foot is definitely a big time player in getting patients mobile. So I hope you found that valuable. If you have questions, leave them below, and I will see you guys on the next Clinical Conversations video.